You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back into the Doctor's Lounge. I am your host, Dr. Hal. Every week we come to you with the information that you need to arm yourself and advocate for your family and for your health care. We are supported by the Docs for Patient Care Foundation, who brings you this show, and that is the only physician-led healthcare think tank in the country, fighting for the doctor-patient relationship and healthcare freedom for all Americans. So please go to our website at www.d4pcfoundation.org. That's D, the number 4pcfoundation.org, and do that now and just give $5, give $10. But you know what? You're home, many of you, and you are looking for information, and we're trying to supply that for you, but we need your help. So please give generously, tell your friends about us, and like us on Facebook, and just try to get the word out, because what you're hearing right now from the media on what's going on is in the majority of the cases, a big fat pack of lies, and we're going to go ahead and challenge some of these things on today's show as we enter week 10 of COVID. We've been talking about this for 10 weeks, and it has sucked out 100% of the oxygen from the room. You know, there was a time where I was just hoping for some healthcare news in the newspaper, and people would take up a healthcare issue. Nobody really seemed to be interested in talking about healthcare. And this is an example of be careful what you wish for, because it may come true. And now everybody is obsessed with healthcare. Everybody has become an amateur scientist, an amateur doctor, and has an opinion. And this is at a point right now where we need to critically analyze what is happening, and the whole issue regarding the COVID is going to be looked back upon in the future by historians, by sociologists, and it's going to be a interesting analysis of human behavior and motives and what has happened, how we have addressed this crisis. And let me just say that COVID is real. COVID is tragic. COVID is a worldwide catastrophe that has really changed how things are going right now and going to transpire in the future. But I think that the response to what's going on right now is now unfortunately media driven. We're going to go more into that in a minute. But I have everything that I have been talking about, that people have been talking about, seems to now be in the forefront of discussions, whether it is the nursing homes and the elderly, whether it is the silencing of doctors, whether it is junk science, all of the things that we talk about as doctors. Now, these are topics that are the mainstream topics of discussion on news shows, on opinion shows, in newspapers. So I tried to think about this a little bit differently, and give this a different slant today, a different angle. And in thinking about what's going on in terms of COVID and how we as a society are handling it, and not the world. I don't want to go into what's happening in Europe or in China or in Asia. I just want to focus on what we are doing here in the U.S. After giving this a lot of thought, I think that the best way to frame what is happening can be summarized by the work of the psychologists Kubler and Ross, the Kubler-Ross scale of grief, of loss. In America, things were booming. Everything was going great, despite the noise from the media, which is the PR arm of the left. Things were going great. We had lots of distractions, of course. We had impeachment. We have the other false narratives by the left. We have the corruption of the last administration regarding the spying on an incoming administration, which is now coming to the forefront. But for the most part, things were going great. The stock market was at an all-time high. Consumer confidence was at an all-time high. We had record low unemployment in our country. You couldn't hire a person because you couldn't find a person because it was full employment. Nobody was looking for a job. The future looked so bright and rosy, and then boom, COVID hit, and we changed overnight. Literally in 6 weeks, the stock market crashed, businesses closed, people lost their jobs, they were forced to change their lives dramatically. So we went from a place where we had something to a place where we had nothing. And so that is typical of what happens when you lose your spouse, when you lose a parent or a child, or you get divorced, or even when you lose a job. That's part of the Kubler-Ross view of grief or loss. And when we lose something so important, so significant, and our way of life as Americans is what we lost. You go through stages of grief, stages of loss, and these are predictable, and they happen over and over again, and you see this happening right now in our society with the COVID pandemic and the loss of our American way of life. The first stage is shock or denial, and people are saying, oh no, this can't happen, this isn't really happening, we'll move on. We heard that the talk at the beginning of all of this, well, this is just a short-term thing, and we will just make some adaptations, and we will then get to the other side. And then on the other side, everything will be booming, and we'll be back to normal. Well, I think that we all realize now that that is not necessarily going to happen. It's not going to be the case. We're not going to see sports, which is an integral part of our the fabric of American culture, where we're not going to be seeing concerts live or seeing the the going to packed bars or restaurants. So there's denial. The next stage in the Kubler-Ross scale is anger. People are angry by what's happening, and of course we're seeing all of that. There are other psychologists who have studied loss and studied grief who have added some things to the Kubler-Ross scale. And let me just go through them real quick so I have them out there in front of you. It's denial and shock, anger, depression, bargaining, and acceptance. And some people have added some others, and they're sort of offshoots of those 5 basic categories. One, though, that they didn't have in there that is real and needs to be added. So a 6th one to the 5 stages of grief by Kubler-Ross would be pain and guilt. And there are a lot of people who are experiencing pain and guilt from this whole episode of COVID. Guilt that they may have contracted COVID and transmitted it to their family members, although that doesn't always translate out clearly. Andrew Cuomo, no, not Andrew Cuomo, but his brother, the CNN Chris Cuomo contracted COVID, and he gave it to his wife and his son, and didn't appear to suffer any kind of guilt or any pain. But there are a lot of people who do. People who may have inadvertently given it to an elderly parent, and then they died from this. There's a lot of emotion that's tied up in what's happening right now, and people are experiencing it, and it's real. So going back to Kubler-Ross, there's the anger, and the anger that's out there is absolutely palpable. People are angry that they've had to change their lives. There's people who had to close their places of employment. We're seeing right now the ramifications of that and what people are doing and how they're responding to protracted shutdowns. That anger is something that many people have not worked through. They have not gotten through this because in the stages of grieving, if you are stuck at any one of these stages, then you dwell there. And if the situation doesn't change and it continues to remain the way that it is, life doesn't move on. You can't get through the stages. And so various people will be stuck at various points on the grieving scale. Some people have gotten through the anger and they're just depressed. They are catatonic. That's how depressed some people are. I have a friend in New York. I have many people in New York where I'm originally from. I have a friend in New York who answers the phone. You would think that they were on drugs, or that they had just experienced a nuclear attack. She is so depressed because everything is closed around her in New York, and she is a shut-in in her apartment in Manhattan. And I honestly, this is one of the most upbeat people that I know, and she is absolutely, just a basket case. The next stage is bargaining. If you in the classic stages of grieving, bargaining is, if you, oh God, it's make bargains with God. If you let, just, get me through this, I'll change my ways. I'll be a better person. I'll start giving back to charities and to the downtrodden. Bargaining is a big part of moving through the grieving process. But the last stage is acceptance, and that's probably an important part of getting through grieving. And that's important when you lose your spouse, when you lose your job, when you lose your home, when you lose something that is tangible. But when you lose your way of life, acceptance is not one of the healthy ways to get through the stages of grieving. And we are seeing that right now because people are not accepting what is happening because they know in their heart that this is phony. This is fake, not COVID, not the deaths that we're seeing, not the seriousness of this, but the response to it, the dealing with it, the science behind it. It's all phony. And people are smart enough now to realize that it's phony. In the stages of grieving, when you have death and you have worked through that and you accept that your loved one is no longer there, you cannot bring that person back. If you lose your job and you know that you're not welcome at work, you accept that because you're not going to get that job back. And so what do? You look for another job. This is different. This is not healthy grieving, not healthy transition through the stages of loss. This is not the end of our way of life. Let's move on to a new beginning. That's what the left wants to see happen. That's what the media is trying to tell people, and that is what we are now combating because the narrative now is this is the new normal. Let me tell you some things that I just came up with as far as a list of things that make me angry. And I will tell you that I'm one of the people who is stuck on that second stage of loss. I'm in the anger phase, and I'm not angry about the disease being here. I am angry at the response. And so I am, along with millions of other Americans, stuck on anger. And I want to just go through a list of some of the things that make me angry. I'm tired of the platitudes and the catch lines that we hear on TV and radio and in print all the time. I hate we're all in this together. We're not all in this together. Who is the we who says we are all in this together? The celebrities who are sitting home, who are making videos and putting on concerts, who are worth tens, if not hundreds of millions of dollars, living in beautiful mansions, while you've got people who are living paycheck to paycheck, who can't work, who are stuck in a little 600 square foot apartment. Those people are all in it together? I don't think so. The people who are running hospitals, the hospital administrators who are sitting in their offices, sitting at home, managing the business of the hospital, while the doctors, especially the young doctors who are totally unprepared for handling this, are thrown in front of these COVID patients, much like putting 18-year-olds in the field in Vietnam to fight a war that politicians in Washington decided that they wanted to fight. Those hospital administrators are not all in this together. They're still making their high 6 and 7-figure salaries, while the doctors are actually being asked to take pay cuts. They are being fired. I'll tell you stories. I'm prepared with stories today to share with you. I have a friend, very close friend of mine in Atlanta, who has worked tirelessly for the last 26 years to build up a medical practice in surgical oncology. He's probably one of the best in Atlanta. And he sold his practice to the hospital that he worked at, like so many other doctors did. And I warned him. I said, don't do this. This is a bad idea. And he responded, no, my hospital's different. My hospital is a good hospital. We're partnership. We work together. We are, we've got a long-term vision. And to make a long story short, that hospital sold to another hospital system, and they fired him last week. And this is the gratitude that somebody gets from a hospital getting fired during a COVID pandemic when he is actually going to the hospital and taking care of these patients. And they fired him because they were trying to cut costs. And he was the highest producer, but also the highest earner in the surgery department. And the people who are making decisions in the C-suite decided that would be acceptable losses. So we are not all in this together. So I'm tired of that. I'm tired of hearing that this is the new normal. This is not the new normal. I refuse to accept that. This is what the left wants you to believe. This is what their PR arm, the media, is perpetuating to people. The more you say something, the more people will accept it as a truth. And this is not the new normal. I will tell you that this disease is now with us. It is in our biome. What does that mean? It means that just like the flu, just like adenovirus, which is the common cold, just like rotavirus, which is traveler's diarrhea, this virus, which is a new virus, is among us. It is not going anywhere. And so as part of the response to this virus, we have to adapt. We have to do some things to make us be able to function, knowing that this disease is in our environment. It is in our biome. And that means that we have to have a strategy because it's not going away. And the strategy involves mitigation, which is what we are doing in our medical practice. We're back to opening up our offices and seeing patients, but we're doing it with with controls in place. We are checking patients when they come in. We're taking their temperature. We are making sure that they are asymptomatic. We are wearing masks. We are cleaning surfaces. We are social distancing. We are spacing our patients. They are not waiting in our waiting room. They're checking in and going back to their car and getting called in if we're not ready for them to come back up to the office when we are ready for them. We're doing everything that we possibly can to make things as safe as possible for people to function. And we're doing a really good job. And it is possible to operate in that arena with those safeguards in place. So that's what is meant by mitigation. We need to protect our vulnerable populations. In Sweden, they didn't shut down. They told people who were elderly or who were immunocompromised to stay home for a while. But everybody else went about their business. They did not destroy their economy. Well, we can do the same thing. We can protect our vulnerable populations with mitigation and doing some common sense things to try to reduce their exposure. We'll get back to the nursing home issue a little bit later in this show. We need to open the economy. You know, as doctors, we have a responsibility to protect the health of our patients. That is our solemn oath. And we take that seriously. And protecting the health of our patients doesn't just mean making sure that they're free of disease or free of pathogens. Those are bugs like bacteria or viruses or other diseases that are out there. But dis-ease means lack of ease. And mental health is a critical part of being a doctor and taking care of patients. And when the economy is shut down, people suffer from dis-ease. They will experience problems with their mental health and suffer from suicide, or that's the extreme, but depression, anxiety. They'll resort to drugs and alcohol, and in the extreme cases, suicide. And our role as doctors is to protect our patients both from physical pathogens and from diseases that affect their mental health. So as doctors, we owe our patients the ability to keep them healthy both of body and mind. And that means that the economy must open up. And that's part of the strategy to get back to where we need to be. And I'm going to go through some more of the strategy issues in the second half of the show. And you'll want to stay tuned because I've got a lot more to say.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
Hi, I'm Dr. Mike Karuchak. Join me and my co-host, Dr. Hal Scherz, as we talk about the topics that doctors talk about amongst themselves, such as Medicare, Obamacare, alternative forms of care, and health information technology. Join us every Thursday morning, 8 to 9 a.m.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docsforpatientcarefoundation.org. That's www.docsforpatientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Doctors, we are back in the Doctor's Lounge. I'm Dr. Hal Scherz, your host. And what should we talk about today? Oh, COVID, of course. Let's talk about COVID some more. All right, before I go back into my Debbie Downer of what makes me mad and how we get through this, let me share some good news, because you don't hear any good news from the media, which are lapdogs for the left and just really have abandoned their responsible role in civil society. They should be ashamed of themselves, and just not even call themselves news people or journalists anymore, because they're not. And let me share some good news with you. Death rates are coming down. They are. You don't hear about that. What you hear about is the number of new cases or the number of aggregate cases. And why are cases still going up in some places? Well, it's because we're testing more people. And the more people you test, the more people you're going to uncover who have the disease. You can have asymptomatic carriers. Unfortunately, this happened with my friend's mom, who had a caretaker who was an asymptomatic carrier, and she developed COVID and is now in the hospital in White Plains, New York. So this is important. Testing people is important so that we can identify who has this disease and keep them away from at-risk populations. But the death rate is coming down. The death rate is one of the metrics that we should be watching, not the number of cases. And it's the death rate, it's the number of people who require ventilators, and those are important metrics. Let me share with you what the death rate in New York is right now. As of yesterday, the death rate is 0.14%. 0.14%. In New York yesterday, there were 147 deaths per 100,000 people. Or I'm not saying that right. Yesterday, there were 135 new deaths. 135 new deaths. What does that mean? That means that the deaths have gone down to almost 1/10 of where they were just 5 weeks ago on April 9th, when it peaked at 1,028 deaths. Even from 1 week ago, there were 279 deaths in New York. And now, as of yesterday, there were 135 deaths. So that's about a 75% decrease in the number of deaths in just a week. And this is what we're seeing all throughout the country. The death rates in the top 6 states, which are New Jersey at 0.12%, Connecticut at 0.1%. Those are deaths per 100,000 people. There are only 6 states that, as of yesterday, had more than 50 deaths. New York, New Jersey, Connecticut, Massachusetts, Washington, D.C., and Louisiana. Michigan and Rhode Island had exactly 50. Pennsylvania, 36. Illinois, 35. Maryland, 34. The majority of states in this country have 10 or less. This is the reason why there is cause for optimism, and this is why the narrative of the left and of the media does not carry any weight. In New York City, the epicenter of the Western Hemisphere regarding COVID, the number of deaths are 191 per 100,000. That's aggregate. That's total. That's not the number of new deaths. That's the aggregate number of deaths. When you break it down by age, and that's really what you want to do, you are seeing that the majority of these deaths are occurring in individuals that are over 75 years of age at 1,427 per 100,000. In the age group 65 to 74, that number goes down to 574 per 100,000. In the 41 to 64 age group, 174 per 100,000. And 18 to 44-year-olds, just 18 per 100,000. Under 18, less than 1 per 100,000. So it's really important not to paint things with a broad brush, but do this surgically. Look at these populations strategically and figure out how do we protect those who need to be protected while letting the country recover, knowing that there's some risk, but taking mitigation standards and other ways to try to reduce risk. Georgia, where I live, the death rate is sharply declining, and this is the state which was absolutely raked over the coals, the governor was, for opening up Georgia. And he was viewed as a buffoon at best and as a war criminal at worst for opening up Georgia. And yet the numbers of deaths in Georgia has plummeted. It is, as of yesterday, the number of people who died in Georgia was 17. 17 new deaths. That's the exact same number that we saw in Georgia on the uptick of deaths on March 26, when that number was going up and up and up. Well, now we're going down and down and down, and we're starting to get back to normal. There are more people who die in Georgia of homicides than of COVID as of yesterday. So I think that this is absolutely critical that we look at this through the correct prism and not look at it the way the media wants to portray it. And so part of getting back to where we need to be, beside mitigation, beside protecting vulnerable populations, beside opening up our economy for the mental health of individuals, is to, number 4, find suitable treatments. And finding suitable treatments means keeping an open mind. It does not mean stifling or ridiculing anybody who has ideas that are different than the orthodoxy, the views that the establishment, that the swamp wants you to believe are the only answers. There's always more than one answer to a problem in medicine. We find that all the time. You know, on my list of things that make me angry, one of the things on there is the great Fauci. Now, I think that he is a wonderful, wonderful doctor who's devoted his life to fighting viruses and epidemics and pandemics, and he's smart as all get-go. But he's a doctor. He's got an opinion. As somebody who has been in healthcare for 40 years, I can tell you that if you get 5 doctors in a room, you'll get 15 opinions. Every doctor has an opinion, including Fauci. And he was wrong about COVID with the first 3 opinions. He said that, it would not spread human to human. Then he said that, it's going to be seasonal. It's no worse than the flu. Then he said that it's not going to come to America. He also said we shouldn't be wearing masks. I don't know if you remember the commercials in the early days, just a few months ago, of COVID, when he and Deborah Birx and the Surgeon General, among others, were saying don't wear masks. And now you get fined in some places in the country if you're not wearing a mask. So he was not spot on. He was wrong about a number of things. But now that he's saying, well, the only way that we're going to see this problem go away is to shutter in place at home, which fits the media narrative. So because that piece of information is the one that they agree with, that's the one that they're going to accentuate and put Fauci on the pedestal as the final word in how to deal with COVID. And he said himself that he's not. It's his opinion, and doctors have multiple opinions, and there are different ways of managing things. And chloroquine is one of those, treatments that work. There are hundreds of doctors who have treated tens of thousands of individuals with chloroquine, which is safe. And the media wants people to believe it's not. Why? Why is the media doing this? Why are they saying that that people who are taking chloroquine are risking death? Why are they saying that doctors who are prescribing it are committing malpractice? Where does the media come off knowing this stuff? They are amateur doctors. They're amateur scientists. This is an example of bias, and a little knowledge is dangerous. Chloroquine has been around for over 60 years, and it has a safety profile that is safer than Tylenol and ibuprofen. And it is there's not a single drug that anybody puts in their body that doesn't have a potential risk, that doesn't carry with it the potential of harming a person, especially if they've got certain comorbidities, other problems that may make them more susceptible to getting a side effect. Every drug has side effects. And if you look at the inserts for every single drug that you take, you would not take a single drug because the list is as long as my arm. In addition, the people in the media who say that the FDA did not approve this drug for the use in COVID. First of all, the FDA is an organization that is, again, not the final word in how to treat patients. Doctors are. And I treat individuals every single day of my career for the last 32 years, taking care of children, prescribing drugs that are not approved by the FDA in children. Those are called off-label indications. And as a doctor, I know what's safe and what's not safe. I know what's going to work and what will help my patients. It's my decision. It is up to me as a doctor who has the best interests of my patients to be able to decide what drugs I want to use and when. And that's what's happening with chloroquine. And it is not Nancy Pelosi's job to have an opinion about this. It is not the governor of Nevada who has made it impossible for doctors to prescribe it. This is between a doctor and their patient. And this is why we do not want government involved in healthcare. And that's something that I'm going to not go into right now. But this is a perfect example of why we cannot have government-controlled healthcare. So there are treatments that are being looked at, and when we have good treatments out there, then it'll be safe to go out. And if somebody gets sick, then you give them a treatment early on. You know, if somebody gets the flu and you wait until they've got a tube down their throat on a ventilator to give them Tamiflu, it's not going to work. But if you are starting to feel sick and you take the Tamiflu a couple of days into your disease, it's highly effective. And that's what we need for COVID. We need treatments because COVID's not going away. We need treatments so that if we get sick, we can take them and we can go about our business. We need a test, a good test, a reliable test. And they're being developed. There's about 4 right now that are in use. There's, I think, over 75 that are out there. Many are Chinese that are absolutely unreliable. But some of the more reliable tests are out there, and I think it's very important to test for active disease, and it's also important to test for antibodies. Again, these amateur scientists in the media are now questioning whether or not antibodies really are going to protect you from another COVID infection for the next wave of COVID. And they are absolutely, just so disingenuous and ignorant. And I wish that they would stay in their lanes because they are doing so much harm to our country. The whole concept of immunity, why we have vaccinations to measles and to mumps and to rubella and to herpes or to human papillovirus, all different kinds of viruses that have immunizations. We rely on immunity. That is called that's active immunity or passive immunity. These are when you get sick and your body develops antibodies and you've got now memory so that if you see this germ again, your cells, your immune cells fight off the infection. That's what an immunization does. It sensitizes your body to produce antibodies so that when that germ is presented to you again, the antigen, your body remembers it and it fights it off. That's the whole purpose of immunity. And these clowns in the media have absolutely no clue about science and what immunity is. Now, we don't know if it's permanent immunity. That is true. And we don't know whether or not this COVID virus is going to mutate and be different the next time around. The flu virus has different strains because it's mutated. So COVID may mutate, but immunity is immunity, and so finding testing for antibodies is important, and looking for a vaccination is important as well. I must say that I'm encouraged by these news reports about a new vaccine that is close to being able to go to phase 2 trials. Phase 2 trials means that it gets used on a wider scale to make sure that it is safe and effective. But up until now, none of the 7 coronaviruses, and COVID-19 is one of the 7, there's not been any successful development of a vaccination for any of the COVID viruses. So, it would be wonderful and a game changer if we could get a vaccination. But I think the other steps that we talked about before vaccination are going to be very important in living with this new virus in our environment, in our biome. And then research. Research is going to be critical. We're going to be researching this virus for the next 50 years, just like we've been researching HIV and Ebola and other viruses that are deadly and highly communicable that are a danger to our planet. So those are the things that are going to allow us to get back to where we need to be. But the most important thing are developing new habits, frequent hand washing, cleaning common surfaces, using the hand sanitizers if you can't wash your hands, and when enough people have antibodies in their system and have herd immunity, then we will be back to life as normal. We've got about 10 minutes, and I want to go through a few more of the things on my list. Calvin and Hobbes, that cartoon, the kid who is like always angry and has a scowl on his face. I feel like Calvin. I have a little cartoon when I give a talk. It has a little thought bubble from Calvin, and there's a caption underneath. And the thought bubble has line in the thought bubble. And the caption says, "Every day I add another name to the list of people who piss me off." And that's how I feel right now. I'm angry and pissed off by how the media is responding to what's going on, to the platitudes, to the politicians on the left who want to see this continue as long as possible to inflict the most amount of pain on the American public, because the more pain that people experience, their calculation is that they will blame Donald Trump, and they would rather see the country burned to the ground than allow him to be president again. And he's done a great job in this pandemic, and don't let anybody tell you otherwise. Could things have been done differently? Yes. Could things maybe have been done a little bit better? Maybe. But he has done a superb job, and he's assembled a team of people that are experts and are doing a great job. And the places where we are getting back into a normal life, Texas, Georgia, Alabama, Florida, have governors who appreciate the response from the federal government and realize that the death rates are coming down and that we have mitigation efforts that are working. It's not because we huddled at home. Huddling at home was intended to do one thing, and that was flatten the curve. Flattening the curve does not mean eradicating the disease. The media is trying to make people think that that's what we need to achieve in order to get back to normal. We're never eradicating COVID. It's not going away. It's part of our environment, part of our biome. What we need to do is learn how to live with it. And the governors of those 4 states have done a great job. In places where they've got totalitarian leadership, New York City with Comrade de Blasio, or New York State with Cuomo, Illinois, and incidentally, Cuomo and the governor of Illinois, Wolf. Not Illinois, that's Pritzker is Illinois. Wolf is Pennsylvania. Pennsylvania and New York, those governors basically committed seniors to death sentences by sending COVID-positive patients who were elderly out of the hospital and back to their nursing homes. And so you don't hear any of the backlash against these misguided politicians who are trying to control people for one reason only, because they can. And their calculus is that the more people suffer, the more people will blame Trump. and the media is all too happy to help to perpetuate that narrative. In my opinion, that's on my list of things that make me angry. It's the media who have perpetuated the biggest crime of the century by not reporting any good news, only reporting bad news, and reporting misinformation. I'm tired of we salute the heroes. You know what? We're doctors, and we go out there and we do our jobs. That plays into we're all in this together, because we're not. And I think that doctors are truly heroes, regardless of whether they are going into the hospital and taking care of COVID patients, or whether or not they voluntarily shut down their practices and could not take care of sick people because they were trying to preserve resources in case we needed them, which never were needed because the original estimates and models were a lie and they were off. And whether or not you want to say that it was done purposefully or accidentally is another issue. But we never got to the point where the system was overwhelmed, and yet doctors have shut down their practices and the patients have suffered. Here's this story plays into this. My mother lives in New York. Her next door neighbor died, not of COVID. She was 80 years old. She had chest pain. She was petrified to go to the hospital because she knew that if she went to the hospital, the media was telling her she would get COVID and die. So her daughter told her, call an ambulance to go to the hospital, and she refused. Her daughter drove up from Virginia, got her. Her mother refused to go into the hospital in New York. She made her take her to Virginia, where they're from. They went to the hospital in Virginia. She died a couple of days later. People are dying not necessarily because of COVID, but they're dying because they're not getting urgent problems taken care of, and they're not because the media is scaring them to death. And this is why they are part of the biggest crime of the century. I'm tired of Zoom. I'm tired of Zoom cocktail parties. This is just it's so trite. It's so over the top, and this is something that nobody wants anymore. I'm tired of Joe Biden weighing in on COVID. He is the most out of touch person in America when it comes to this, and he has absolutely no place saying anything about COVID. I'm tired of recording artists who are living in their mansions with net worth in the hundreds of millions of dollars doing free concerts and saying that we're all in this together. I'm tired of the House of Representatives not being in session. I'm tired of people with no skin in the game being paid and staying home and telling the rest of us to stay home when they have absolutely nothing to lose. There's so much that's so wrong about what's going on and what's happening around the country right now with people finally waking up and being civilly disobedient is going to overwhelm the media, in my opinion, and we're going to get back to normal within the guardrails that we set up. So that's all I've got for today, and I want to thank you for letting me rant and fill you in on some of the things that I'm observing right now in this COVID crisis. And come back to me in 2 weeks, but come back in a week and listen to my co-host, Dr. Scott, on the Doctor's Lounge on America's Web Radio.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
The Docs for Patient Care Foundation is